How much does your diagnosis affect the prospects of your lower back pain or sciatica getting better? This is a topic we're going to be exploring in today's episode of the podcast. And as always, we're going to have the accompanying article, which you can check out using the link in the description to read a little bit more about this topic and get a better understanding of some other examples as well. We thought today we'd go through a specific example of a case of grade 3 spondylolisthesis in the lower back. What is this? This is when the vertebra shift out of place, literally, and we're talking about one shearing on the other. We're talking about L4, L5, L5S1 is the most common area that this happens, but we're using this as an example. It doesn't matter what condition you have, whether it's a disc bulge, whether it's some other diagnosis that you've got, those could all be inserted in the place of spondylolisthesis. The reason we're choosing this example is because it's such a stark example from very shortly after I'd graduated from university that I saw in clinical practice that really illustrates how much the diagnosis really matters to your prospects of being pain-free. So before you say, hey, I don't have that condition, just insert your condition here, but see what's possible with this particular example. So and just for reference, think about the vertebra sliding forwards. Think about your knee joint, for example, because that's a very good similarity to draw with regards to getting the true understanding of just how this thing is going on and how this condition is one of the more severe conditions that you could have. Imagine your knee joint shifted 3/4, so the top bone, the femur, shifted 3/4 off the tibia, like so. That wouldn't be very stable. So this girl walked into the clinic, had some imaging done. It wasn't with me, but it was one of my colleagues at the time. And basically she had this grade 3 spondylolisthesis. She was a gymnast. She was in her early 20s. And for ease of today's episode and in the article, I've just called her Sarah. That's not her real name. But Sarah had next to no back pain. She was a gymnast, very active, physically well conditioned. And she had this situation. And that's really not a good diagnosis, but she had next to no pain in spite of what is a serious diagnosis. And I wanted to play out for you how her life, her pain, her back pain or back issue could play out over the next 20 years. Because so often in clinical practice after that point, we would see the Sarah in 10, 15, 20 years time. We would see her in her 30s and 40s saying, oh, I've just had this pain for the last 6 weeks or 6 months. And I've seen a couple of other people and they haven't really known what to do. They've just said it's a muscle spasm. Why does that happen? Well, the reason that happens is Sarah's very conditioned in her 20s. At the time we saw her in the clinic, she was a gymnast. And gymnasts have a peculiar set of attributes, which is very good for back pain or very good for prevention of back pain. The ability to compensate even for something like this, in that they're very, very strong. And they also have a great degree of flexibility, particularly in the hips, etc. And the great flexibility of those hips means that for most of the movements of daily living, they don't need to use the lower back because the hips do it. So the lower back is not having to get itself into perhaps as precarious positions through the daily living. But what happens in cases like Sarah and others is she maybe goes to university, gets a job, etc., starts doing less gymnastics. And gymnastics is one of those things that you tend to have done for a long period of time. Prior to your 20s, you start very young. It's quite time consuming. You spend a lot of time and dedication to doing that sort of sport. So you build up a good physical condition, generally speaking. But when those sorts of individuals, and maybe you haven't built your physical conditioning to that level, and that's okay, but you might have built it to some level. You probably were healthier and fitter and stronger in your 20s than you perhaps are today. And gradually over time, as we become an adult, we have work, we have social commitments, we have family commitments. And all of a sudden that ability to maintain that level of physical prowess starts to decline. And there's this gradual degradation, and maybe she has kids, has a family, 1 or 2 kids to look after, the process of pregnancy itself being a challenge for any woman, no matter what. And then raising those children involves a lot of bending down, time on the floor, etc. Less time to look after herself. And then gradually, as she maybe gets to her mid to late 30s, early 40s, she starts to notice this back pain. Well, what's happened there? We've taken a person with significantly above average physical competence, harboring a significantly greater than average degree of disadvantage in her lower back. And that imbalance has allowed her to maintain being pain-free or not really having any significant pain on a day-to-day basis and able to do the things that she wants to do, look after the kids, etc., live a good social life, live a good work life, etc. But gradually the advantage she has in her muscular system has degraded because she hasn't been able to or had the time to or had the inclination and discipline later on to be able to keep up that good condition. And now, as we get to the 30s and 40s, that physical conditioning more approximates that of the average person, but she's not walking around with the average person's spine. She's got a worse than average spine because of that diagnosis of the spondylolisthesis. And when she first goes and sees practitioners, they'll say, maybe it's the GP, maybe it's the osteopath, physio, whoever it is, it's just a muscle. You're just getting some muscle spasm and a little bit of sciatica. It'll go away, do these exercises. It'll go away, we'll do this treatment. And then eventually it doesn't work for obvious reasons, because never has been a case. It's never been a case of saying, actually, you need to really recondition. And you don't have the confidence in doing that because maybe they haven't gone down that route in the clinical room to explain that to you. But needless to say, it doesn't get better. It gradually gets worse. And then you have some imaging, and then the doctor goes, or the specialist or the orthopedic consultant goes, gosh, Sarah, you've got a grade 3 spondylolisthesis. And you think that must have happened just then or shortly after. That must have happened 6 weeks ago when I hurt my back, picking the socks up off the floor. Of course it didn't. That's not when it happened at all. But that's the perception of what happened. And now all of a sudden the world comes crumbling down. I can never be pain-free. My back's in this terrible condition. Oh my God, the thing's gone out to the side. I've got the herniated disc. I've got this, that, the other. I've got terrible degeneration. I've got stenosis in my back. The reality is she had that there for many, many years without pain. And that should send a light bulb off. Maybe there's reasons that we don't do these sorts of things habitually or regularly, but with modern technology, so many people are taking the opportunity to do blood tests, to do various other tests, to have a look at their health, take snapshots of their physical conditioning in any number of ways, and actually say, hey, that's not right. That's not right. I could do some things before the pain comes in to actually offset some of these things. But again, pain is a great motivator. Sickness is generally a great motivator to make you realize that you don't have health now and motivate us to do things. And maybe if we'd found these things out before, we just wouldn't have done anything about it because we don't really have any pain, and that wouldn't have motivated us to do it. For other people, it's a great wake-up call and they can go and do something. But the point remains that she had the diagnosis long before she had the pain. And we'd see this in clinic more recently over the years, where patients would come in and they say, I've only had this for 6 weeks or 6 months. But then you look at the imaging and go, well, this spine's been degenerate for a long period of time, judging by the markers that we're seeing on the imaging and judging by the radiology reports and judging by the other reports. You can see that this has been there long before the pain has been present. So then we go back to that question, how much does the diagnosis affect my recovery? Well, if you had it before, and you didn't have pain, we can get you back there. Now, the big thing with Sarah in this example is she's just lost so much physical conditioning. Like most people, they lose physical conditioning because we do not take the time to maintain that physical conditioning because it requires work and other things become more important. If we don't have pain, we're not motivated to do so. But now if you're watching this and you do have pain, you have the motivation. And now it's we need to make a point to do it moving forwards. Be careful because people get caught up with these things. Oh, I've got this condition or that condition. Let's just put the bones back. Let's just click things. Let's pop things. And all of a sudden you're going to feel okay. And quite often in the early days of managing the first couple of flare-ups of these sorts of conditions, those sorts of things help or they make you feel better, but they're not addressing the underlying cause. No one treatment, one thing is going to fix an injury. And remember, you have an injury in your back. The tissues around, let's say in this example for Sarah, the spondylolisthesis, those tissues are under strain. They're decreasing in health because she's not looking after the back properly over those 10, 15, 20 years of adult life. And so they have become degenerate, they've become degraded, and they get strained by the opportunity to go and pick a child's toy up off the floor or pick the shopping out the suitcase. They're the things that got strained, got inflamed, and got injured. And no clicking or popping or this or that or the other, one thing is going to heal that. No more than if I had a cut on my skin. You would laugh if someone said, yeah, I'll just do this quick click and pop of the skin and it'll all feel better again. No, of course not. It might feel better at the time, it might take the pain away, but the healing still needs to take place. And here, hopefully, we see that healing and the pain levels that you experience are not indicative of the graveness of the problem or the injury afoot. They are not indicative of the health of the overall structure. There are plenty of conditions that are tremendously painful and not serious at all, and others that have next to no pain. Because most conditions, most serious conditions anyway, or conditions for that matter anyway, have long tails. They have a long period of time where there is no real significant disruption to your daily life. And then all of a sudden it often comes in quite severely. And we realize this has been building for many months, years, or in the case here with Sarah, it's been there for decades. And actually, that can sound rather gloomy, but I would put it to you that it's not gloomy. It's that your body, if you look after it, you all have, no matter what age you're watching this at, you all have the capacity to be better than you currently are, to be stronger than you currently are, to be in better physical condition than you currently are. Where you start is obviously going to be completely up to your current level of conditioning right now, but you have the ability to be better. So what do? What do you take away from this particular message, this particular story, this anecdote, this individual case study? Well, it's very reminiscent, most likely, of what you have experienced. You had better physical conditioning, and maybe you were harboring and managing, your body was handling some of the inefficiencies and imperfections that we have in our body as a result of maybe some disadvantageous practices, maybe some trauma, but most often it's that repetitive strain that your body is managing to handle. Those tissues are getting worn out. For example, just like the child that is constantly skidding on their bicycle. The tire is managing, but it's only managing for so long, and then boom, the tire bursts and we have to go and replace it. We have to do something about it. Well, with a little bit of education, we can stop skidding the brakes. We can stop skidding on the back tire, and that's going to help things not worsen going forwards. But then we do our rehabilitation. We start with a couple of things to stabilize our spine, learn to control it better again. And this is accessible to everybody. If you can lie on the bed, or if you can stand up, or even if you can sit down, you can do those sorts of stabilization exercises to learn to hold your spine steady. And then you can start to do those sorts of spine stabilizing exercises with a little bit of load of gravity, standing up. Maybe adding a little bit of load to the spine to steadily start to rebuild what has been lost. And that is the strength and stability and structure of your body around that lower back, forming a shield of armor for the underlying joints to protect them from wear and tear and damage and erroneous forces impacting them to the point where they become overwhelmed and injured. And you start to build that back up again. And then with time, you start to scale the resistances that you're using to build up tolerance to activities that you might come across in daily life. You might want to pick up that 25 kilos holiday suitcase. You might want to move that pot in the garden that weighs 15 kilos and is on the floor. If you have no flexibility, which comes in next, you're not going to be able to get down there. But you need strength first to have the competence to move fully through those ranges of motion, which is why those gymnasts are in such a great position when they're younger, because they build great flexibility with good strength, very good strength. Not necessarily akin to a powerlifter, but a powerlifter doesn't have the flexibility of a gymnast. So that's something, there's always a trade-off at the extremes, but for the average person, you need to have that flexibility come in a little bit later as you start scaling the resistance that you're using so that your body becomes resilient and you're able to do those activities of daily living without them overwhelming your body and creating too much strain on an area that is vulnerable. And then, and this is the all-important part, it's no good you being textbook perfect with your exercises and doing your squats with lovely form and able to do a nice hip hinge with great range of motion, and your lunges are absolutely fantastic on all the other exercises, you do them great. And then you're bending down, rounding like a little fishing rod to pick things up off the floor. The practice outside of the exercises becomes important. Being more diligent and more mindful of the way in which you move. Yes, it's a hassle in the short to medium term because you have to change the way you do things. But once you've done that, they're done just on autopilot like the other things. And take a look around you on a daily basis. You'll see other people doing movements and things in their own unique ways. Why? Because that's just the habit that they fell into. They did it a couple of times. They got into that habit, maybe for whatever reason. And now all of a sudden, that's how they move. But you can learn your own new habits that are friendly for your back, that offer little to no extra effort, and if anything, become effortless with time as you get better at those movements. As long as you do this, and the all-important word consistency, add consistency over time, it doesn't matter what diagnosis you had. It doesn't matter if the symptoms move from the left butt cheek to the right butt cheek, or the left big toe to the right thigh on the back of the thigh, because you had a flare-up, because you did something you know you shouldn't have done, or you had a little bit of an accident. Maybe you missed the step or the curb as you were walking down, and that jarred the back again because it hadn't fully healed from the last episode. It doesn't matter which one of those are. Don't let them throw you. Make an honest appraisal of your personal physical conditioning and have a think about that diagnosis you maybe had. Is it rational and reasonable to suggest that it might have been there a long time before? Is it that it was initially caused by some significant trauma? Or was this recent episode just you putting your socks on or picking up something you've picked up 1,000 times before? Most of the time it's that. Most of the time the back pain that prompts us to do something about it is something so silly, it's so frustrating, and it's so annoying. But our backs are not that vulnerable unless we allow them to become that vulnerable. So it matters little which individual final little trauma, little accident, little movement of a sock caused this episode of back pain. And it matters little, aside from, of course, any red flag symptoms that you might get of cauda-equina, etc., which are very, 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 very rare. Aside from those, it matters little where specifically that leg pain, if it's going halfway down the thigh or 3/4 of the way down the thigh. Focus on moving forwards. focus on that critical appraisal of your physical conditioning and move forwards from there. We can all do it. Doesn't matter if you've got an L4 5 disc bulge, you still need to do that strengthening work that I've discussed. Does it matter if you've got a grade 2 spondylolisthesis? You still need to do the work. Does it matter if you've had surgery and fusion to your spine? You definitely still need to do the work. And does it matter if you've so far only been diagnosed with a minor muscle spasm? Again, referencing last week's podcast on muscle spasm and the silliness of that sort of diagnosis, you still need to do the work. Have an honest appraisal of your physical conditioning and actually take back a bit of control. You don't need to rely on other people to do things to you to get you better. You have what you need. You might need a bit of guidance along the way. You might need help. You might need help to do the right things, but no one at all, even if you're going to spend tons of money, is going to do that work for you. Even if you're going to have stem cells, even if you're going to have a PT come and do things with you every single day of the week, even if you're going to have a therapist in your house living with you and you're going to spend all the money to do that and all the fancy supplements and all the fancy this, that, the other, it matters for nothing if you don't do the work. You have to do the work. It's simple, but consistency often and simplicity are not things that people look for. They want that quick fix, that fancy thing, that thing they can brag about. But really, it all comes down to doing the basics well, consistently, over time. If you do that, you're going to do better. I hope that this episode has made you think twice about that question. Think twice about how much your diagnosis really affects things, and have you been guilty of letting your diagnosis and that search for a specific diagnosis affect your ability to execute on the basic fundamentals. Again, as we discussed on episodes like the one on surgery, on episodes like the treatments that you can do for back pain, it doesn't matter with those things. You still need to build spine stability. You still need to build an ability for your spine to tolerate load. You still need to improve the flexibility of your hips. None of that is negated, no matter what the diagnoses are. The uniqueness, as we'll maybe discuss in another podcast, the thing when people ask, oh, should it be tailored to me? It needs to be tailored to my specific thing. It's not tailored to your symptoms. It's not tailored to your diagnosis. It's tailored to the things that you're missing that allowed that diagnosis to come into it, become a problem. It's tailored to the things that you can't do. It's tailored to the inefficiencies in your structure. It's tailored to the inefficiencies in your ability to do certain movements. And the only way you're going to find out what those are is by starting to move through a program that is all encompassing in terms of building a strong spine. And realizing that I can't do that bit, and I can't do that bit, and I can't do that bit. Those are the bits that are unique. Those are the bits that you will need to overcome in your quest, in your journey to getting your back in shape. So a little bit of a teaser maybe for a future episode there, but hopefully you did find this one helpful. And maybe you can share it with someone else who's been really struggling to find answers for their back pain or their sciatica, and allow them to move forwards in a more productive and more empowered way. As always, thanks if you made it this far through the episode. Hopefully it has been really, really helpful for you. And give us a thumbs up if you did find it useful. Consider subscribing to the channel so you make sure you stay up to date with every week that we release the podcast. And remember, that comment section is there to help you. If you've got any questions, anything's unclear, use the comments below. Thanks for watching. We'll see you in the next episode.